This is the Horse Radio Network. This is episode 188 of Horse Tip Daily, a different horse tip, a different equine topic, a different equestrian expert every day. Horse Tip Daily brings the world of equine knowledge to you one day at a time. Today's tip is sponsored by Kentucky Performance Products. Visit them at kppusa.com. Enjoy today's tip. This is Glenn the Geek from Lexington, Kentucky, back with you on Horse Tip Daily. Well, today we have another veterinary tip for you, and I have gotten some questions about why we do so many veterinary tips. One is people seem to like them. We get emails about veterinary tips, and people seem to enjoy that, and it does apply to all horse owners, whether you're English or Western, whether you ride upside down, side saddle, side seat, however you ride, it doesn't matter, or drive, you always can use the vet tips. They apply to every horse. So that's the reason why we do stack the deck a little bit more with vet tips is for that reason. And they're relevant, and you can never learn enough about about the veterinary care of your horse. Well, today is Dr. Jenny Johnson, our contributor to the Jumping Radio Show at jumpingradio.com. She runs the Oak Hill Shockwave and Veterinary Chiropractic Clinic that's based in Calabasas, California. I just love saying that, Calabasas. And so we'll have Dr. Johnson here with us off of episode 7, and this is co-hosted by Chris Stafford. You can find the rest of the show by visiting jumpingradio.com and look for episode 7. But first, a couple words from our friends at Kentucky Performance Products. And Kentucky Performance Products is a local company that offers you the quality assurance that you are looking for your sport horses. Each supplement is manufactured to exacting standards in certified facilities. Their ingredients are forged from highly reputable suppliers, and their formulas are fixed to ensure consistency in each bucket. Kentucky Performance Products has recently unveiled their newest product called Contribute. Unlike other omega-3 supplements, Contribute contains both plant and marine sources of omega-3 fatty acids. Omega-3 fatty acids support virtually every system in the horse's body, including the immune system, reproductive system, nervous system, bone development, and the cardiovascular system. Contribute offers horse owners, breeders, and trainers an affordable way to provide beneficial omega-3 fatty acids to their horses. Learn more about Contribute and all the products at Kentucky Performance Products. That's kppusa.com. That's kppusa.com.
Well, I thought I would just talk a little bit about shockwave therapy, how it's used, what it is, and what we can expect from it. Just sort of educate our listeners a bit more about shockwave. I think most of our listeners, or certainly many people, have heard the terminology shockwave therapy, but perhaps don't have a clear understanding of really what shockwave therapy is. It's a non-invasive treatment, and it can enhance and facilitate the healing of many types of both orthopedic and soft tissue injuries. It's been used in people for many, many years, particularly in parts of the world outside of the U.S. It's been used in the U.S. and is approved by the FDA in people to treat heel tendonitis as well as tennis elbow. In the rest of the world, it's used for many, many other types of musculoskeletal injuries and fracture healing, non-union fractures, arthritis, and it's also being used for burns and wounds as well. It's the same technology as lithotripsy, which some of our listeners may be more familiar with that terminology in human medicine. Lithotripsy is a technology used to break up kidney stones. And with those types of machines, the shock waves are focused to a very fine pinpoint because they're trying to explode a kidney stone. Now, the shockwave machines that are used in veterinary medicine have a much larger focal zone for the energy, so that we're not directing a huge amount of energy at a pinpoint, but rather over a larger area, and that has quite different effects on the body. So, first of all, really, what is a shockwave? Many people ask me, is it some type of electrical shock? And it's not. A shockwave is a pressure wave, and a good example of a pressure wave is when you throw a pebble into a pond and you see the ripples that go out from that pebble. Those ripples are shock waves. Another example of a shock wave, something that we're well acquainted with here in California, is an earthquake. The movement that you feel or the waves that you feel sometimes from an earthquake are shock waves in the earth. So, a shock wave is defined as any action that displaces its surrounding medium. In veterinary medicine, there's a variety of ways that those shock waves can be generated. One of the more common ways is with an electrohydraulic generator, and with those machines, a shock wave is generated inside a fluid-filled probe head, and then it's transmitted through the fluid-filled probe head, through ultrasound coupling gel, and then through the soft tissue. And depending on the type of probe that's being used, the energy is released at a specific depth, and that's what we call focused shock wave. The energy is focused to a specific depth. It's focused to a specific area. I'll talk a little bit later about other waves that aren't focused, but for the purposes of what I'm talking about today, I will be talking largely about focused shock waves. So, now we know what a shock wave is. Well, what can it do? The field of shockwave medicine really is a really exciting field. There's so much research going on in the field, and we're learning new things all the time about shockwave therapy and the potential applications for its use in both human and veterinary medicine. What we do know is that it has a fairly potent anti-inflammatory effect. It definitely increases the circulation to an area to the point where it actually causes new blood vessels to grow into an area fairly quickly, within a matter of days, really. And it also stimulates a whole host of growth factors that are important on a cellular level in the healing process. There's been a recent study that came out looking at how shock waves interact in the arthritis process, and it actually was shown that shock wave therapy can downregulate two of the substances that are critical in the ongoing degradation of cartilage in arthritis. And that's really exciting because that means that shockwave actually has the potential to interrupt the arthritic process. And that will affect the way we use shockwave in treating arthritic horses. I'm just going to sidestep a little bit here, but traditionally we've sort of thought of using shockwave in arthritic horses when joint injections or intra-articular injections were not working as well. But I think with this new information, the thought is let's use shockwave earlier in the process, and maybe we can actually disrupt that process a little bit. The other things that shockwaves can do, or they cause they can stimulate osteoblast formation. Those are the precursor cells to bone cells, and they're required in fracture healing. Shockwaves are also thought to stimulate fibroblast formation, which are the cells that are required in tendon and ligament healing. Another really interesting aspect of shockwaves is that they have an antibacterial capacity. And so they're being used now in a lot of infected wounds, burns, and have been having some quite interesting results on that. And I actually just had a paper published, or a case report published last month in Equine Veterinary Education using shockwave to treat a very extensive burn on a horse. In horses, it's unlikely that we'll have too many controlled studies on shockwave therapy in burns, but it's certainly an application that can be useful and should be considered as a possibility. One thing I will mention here is that we do know from shockwave therapy that there is a brief period of analgesia or pain relief after the shockwave treatment is given, usually up to about 48 hours. I always advise people that there is a period of potential pain relief, and that, from a practical standpoint, is important, particularly in our show jumpers showing at the upper levels. There's a 5-day waiting period after shockwave therapy before they can compete at the FAI level. So on a practical level, what can shockwave treat in horses? And I would say by far the most common thing that I treat with shockwave therapy are suspensory injuries. And I think that probably almost all suspensory injuries could benefit from shockwave therapy. I treat everything from, say, a mild inflammation in the suspensory all the way up to something with a well-documented hole, if you will, in the suspensory, including those injuries where they have a avulsion fracture, where a piece of the cannon bone has actually been pulled away by the suspensory ligament. And I've had quite good success with those cases. The other things that it can treat are, any type of tendon or ligament injury. We've touched on arthritis, certainly a viable method for treating arthritis. Collateral ligament injuries, any type of injury in the foot, the impar ligament, the deep digital flexor tendon, some aspects of navicular syndrome. We can use it in ring bone. We can use it with generalized joint inflammation and pain. I use it a lot on back pain, and also horses with some neck pain. So there's really quite a wide range of applications for it, and I think that field, we're just learning more and more all the time about the different applications and where it can be used. In terms of protocol, that varies with each individual case. Each individual case obviously has to be looked at with the primary care veterinarian, and if that veterinarian has Shockwave capabilities, they'll make that decision. Or certainly in the area where I practice, I stay in close contact with the horse's primary care veterinarian, and we stay in touch and make a plan based on the individual circumstances of each horse. Having said that, by far the most common protocol that I use is generally a series of 3 treatments spaced at about 3 weeks apart. Now that's going to vary considerably as to whether it's an injury that is keeping the horse out of competition, whether it's something we're treating while the horse is in competition, or the schedule is, what their layup or lack of layup is, and so that really is an individual case scenario. Another question that I get asked frequently is using stem cells versus Shockwave or in combination with Shockwave. And regenerative medicine, or the use of stem cells and the like to treat injuries in the horse, is a really exciting field. I just returned from the first annual North American Regenerative Veterinary Medicine Conference. It was held up in Solvang, California, and really brought together researchers from around the world to talk about stem cell therapy and other aspects of regenerative medicine and how it's going to play a role in veterinary medicine in the future. And it certainly will play a role. How that plays out exactly is yet to be seen. I think right now we're definitely in the infancy of that area of medicine, and we're sort of trying out a lot of different protocols for what can be used with stem cells. Now, in terms of shockwave therapy, I very much like shockwave therapy in most of these injuries for one reason in particular, is that it's non-invasive. Stem cells, you're definitely going to have an extraction of the stem cells followed by an injection of the stem cells, and that certainly is an invasive procedure, whereas shockwave is non-invasive and can be used, I would say, more widely. But certainly I do also use shockwave in conjunction with cases that are undergoing stem cell therapy. And typically what I'll do in those cases is typically get one shockwave treatment in. The horse may then go to have the stem cells extracted, and there's usually a period of approximately 3 weeks before those are cultured and ready to re-inject. And so I'll typically get the second shockwave in before they've gone for their stem cell injection, and then follow up about 3 to 4 weeks later. I like to wait at least 3, probably 4 weeks after stem cells have been injected before following up with shockwave therapy, just to ensure that there's no adverse effect on the stem cells by the shockwave. Now, one other thing I'd really like to touch on is the difference in shockwave machines that our listeners may not be acquainted with or familiar with. For some reason, there are types of machines that do not actually generate a shockwave, but generate a totally different type of wave called a radial wave or a ballistic wave, that those machines have somehow been called shockwave machines. I'm not sure how that's happened, but they're not actually generating a shockwave. And the importance of that is that the physics are completely different on those two types of machines. And it will definitely play a role in the effectiveness of the treatment. These other machines that generate ballistic or radial waves typically look like a small jackhammer. There's a projectile that's rapidly accelerated by compressed air that basically bangs against the treatment area. Those devices can be useful in treating injuries at the skin, but they're not very successful at treating injuries elsewhere because the majority of the energy is deposited right at the skin. Those are what I was referring to as the unfocused machines. The shock waves are not focused, so you're applying all of the energy of the shock waves or the ballistic or radial waves right to the skin. And as I said, a superficial injury, that's fine, but if you've got something like a suspensory or certainly a back or a neck, those are not going to be very effective. The other problem with those machines is that you're applying a lot of energy to cells that you don't necessarily want to be applying that energy to. So that can be a problem as well. And I think it's important that our listeners understand the difference between those machines. And typically, also, those treatment with those machines will be considerably less expensive than treatment with a true shockwave machine because they're much less expensive machines are not as sophisticated as the true focused Shockwave machines. And the other thing that I think is really important for our listeners to have an appreciation for is who's holding the probe. In my practice, it's only me that holds the probe, that does the shockwave therapy, and I'm very specific about that and diligent about that, because to me it's critical that the operator have a very detailed understanding of the anatomy. Now that we have access to MRI and scintigraphy, we're getting very specific diagnoses with very specific locations of injuries. And because of that, we need to be very careful where we're directing the shockwaves. If the operator is off by as little as 5 degrees in how they're holding that probe, it's very easy to completely miss the target, in which case all of the money you've spent treating the area with shockwave was wasted. So to me, I think that a veterinarian or someone with a very strong education in anatomy should be the one holding that probe. I think that's very important. Another thing that I would like to just share is that here in the United States, shockwave therapy is covered by most of the insurance companies, at least to some degree. They will sometimes put a cap on the dollar amount, but it is covered for those people that have major medical by many of the insurance companies, and I think that makes it a lot more viable in terms of a treatment modality for people. And it's I've found that shockwave has been very useful in all sorts of cases, ranging from very severe injuries to fairly mild injuries. In many cases, we're able to keep horses in competition that wouldn't otherwise be able to compete. And we're not just covering up some type of injury, we're actually stimulating healing and enabling the horse to function more normally with shockwave therapy and helping them to continue to heal while they stay performing at their job.
Well, thanks again to Dr. Johnson and to Chris Stafford. As I said, this was taken off of Jumping Radio Show, Episode 7 at jumpingradio.com if you want to hear the rest of the show. And we would love you to listen to all the shows on the network at horseradionetwork.com. Well, I'll be back again tomorrow with another new expert and a different horse tip. Until then, stay safe, everyone.